Welcome to the Game Changer Unlocked, where we explore the people, innovations transforming the world of sports, performance, and recovery. I'm your host, Bryan Fetzer. Whether you're an elite athlete or a weekend warrior or someone that just wants to feel better and move better, we're here to bring you the cutting-edge insights to help you reach your peak. Today's guest is someone whose work is truly changing the game in sports medicine. Dr. Larry Balle is a double board certified physician in both primary care sports medicine and family medicine. He specializes in non-surgical orthopedics and regenerative medicine, helping athletes and active individuals heal using the power of the body itself. From working with NFL stars to Olympians to NBA players and caring for a wide gamut of individuals, Dr. Balle brings world-class expertise to every single patient. He's here to help us understand orthobiologics, we're going to talk about that a lot, like PRP therapy, giving people a second chance to perform without surgery or downtime. Dr. Balle, welcome to the Game Changer Unlocked.
Yeah.
So, let's get started with the basics. PRP therapy. Kind of explain that a little bit.
Sure. So PRP therapy, the acronym stands for platelet-rich plasma. It's a blood product that is derived from blood draw. So the idea behind it is you take everything from the individual's own blood circulatory system, concentrate it down, and put it back towards an injury or an area where there's an inflammatory process creating pain. The thought process behind that versus a medication is I'm using what's called an autograft, not necessarily steroid or Toradol or some other kind of medication. You can take that and apply it to acute injuries or chronic injuries, so soft tissue versus joint, and I'm augmenting the healing process. So by doing that, you can return people back to whatever sport or activity that they're trying to get back to.
When people hear regenerative medicine, they assume it's something futuristic. Can you explain kind of how orthobiotics like PRP actually work to help repair injuries naturally using the body kind of as its own tool?
Sure. So there are several things within the body's plasma that we're isolating and concentrating down. Platelets are a big part of that. There's also different white blood cells, including monocytes, that do that. There's proteins called cytokines, and there's different growth factors. By isolating some of those and concentrating them and putting them back down into an area where there's an injury, specifically with an ultrasound, you can directly target an area. You're stimulating the body's own healthy response and own immune response to reproduce and help heal and recover. You don't necessarily regenerate cells. So if someone has bone-on-bone arthritis, you're not going to put that into a joint like their knee, and then you're going to regrow cartilage, but you will stabilize and help the cartilage that you have left. As far as the regenerative process, you're more regenerating that healing response that once you get to a chronic stage may not be the best that it's able to be. And so by stimulating your body's signals to attract more cells and more of that healing process, that's where that name regenerative process or regenerative medicine comes from.
So who's a good candidate for PRP therapy? Is it just elite athletes? Is it weekend warriors, or who really can benefit from PRP therapy?
Yeah, it's a good question. I see a handful of consults every day from the 90-year-old person with end-stage knee arthritis, a patient who's a transplant patient who's been told they can't have certain kinds of medications like additional steroids or NSAIDs, diabetic patients who also can't have some of those medications. So really, it's anybody that has any kind of injury can potentially benefit from some of these. And that doesn't mean that you have to be, a star professional football player, a high school, basketball player. I see marathon runners. I see, the dad that goes out and jogs with his kid, behind the stroller kind of thing. And anybody who has any kind of musculoskeletal, as far as my world goes, I'll have a conversation with them and we can talk about which type of blood product or plasma product or regenerative medicine category might be beneficial for them and might be beneficial for their specific ailment or injury.
So what types of injuries or conditions have you had the most success treating with PRP therapy? Is it tendons, joints, post-surgery? What might be specific with that?
So I've treated all of those conditions, and probably one of the more common ones I see is mild to moderate arthritis. Knee is one of the more common, as well as hip. and then glenohumeral shoulder. Now, I'm not talking end stage arthritis like I mentioned a second ago. More of that, if you grade arthritis 2 or 3, and obviously the lesser the stage of the arthritis, the better outcome you'll have. Now, if you have an unstable knee with an ACL tear, that's not something that would necessarily benefit from an orthobiologic product. Or if you have an unstable shoulder, so your shoulder keeps dislocating, that's not something where you'd benefit from. But if you have a cartilage injury in your shoulder, you have a ligament injury around the shoulder, around the knee, outside of the knee, or you have like patellar tendonitis. I saw someone today with patellar tendonitis, and we talked about how an orthobiologic product might be beneficial in their treatment regimen. So anything musculoskeletal may help augment care, and it can be chronic or acute. Most of the patients that I see, I'm in the Texas Medical Center, so largest medical center in the world. I'm usually at least the third, if not, sometimes fifth or sixth person they've seen, and they've been told there's no additional options for them, and there's nothing that they can do, and so they come see me as another person for another opinion.
So when you start thinking about the regenerative process and how things work, is there anything that someone can take, whether it's a supplement, food, or specific medicine before or after the PRP injection to kind of help reduce inflammation and kind of start that healing process? Or is there anything that they can't do?
Yeah.
Because I think that's important.
It's a great question. And I get asked this question, every day. I have this whole profile that we send out to patients pre-procedure a week before to make sure that everything is kind of teed up. I actually have a paper sitting on my desk right now that's evidence-based that shows some of these things. In reality, a lot of what you would take supplement-wise or diet-wise will unlikely make that big of a difference in your plasma product or your blood product. However, avoiding anything that's anti-inflammatory, so that's like a non-steroidal anti-inflammatory drug, ibuprofen, Aleve, steroid, steroid injections, methylprednisolone, that includes cortisone that you'll hear people talk about. Some of the more natural anti-inflammatories like turmeric, bromelain, those kinds of things can actually post-procedure help and stimulate some of the body's response. But pre-procedure, we usually tell patients to stop them for a number of days. Platelets live for 10 days. So some of the studies show at least 5 days pre-procedure stopping those medications. I tell patients if you're paying for this procedure, it's a cash-based procedure, you want to get the most out of it. So I would stick as close to that 10-day as you can. And then, the other thing in that paper that I was mentioning talks about diet. So I'll have some hardcore patients that come in, I'll have Olympians come see me and they'll ask me, and they'll do like the Whole30 diet before they come in, and they want it to be as clean as possible. So that's where you're, not eating any processed food, not eating any sugar, trying to stick to lean meats that are not processed in antibiotics or, anything like that. That's kind of extreme. Do I think that probably helps? Sure. For the, normal person, the everyday person, I don't know that it makes that big of a difference. But again, I tell people, if you're paying for it and you want to get the most out of it, then these are some of the things that might give you some benefit.
And that makes total sense. There's talk about avoiding surgery with PRP therapy. Can you share an example of a patient that was might be able to skip a major operation thanks to the kind of the regenerative therapy?
Sure. I see a number of them, and often a lot of the patients that I see, they're not wanting surgery, and so I'm a non-operative sports medicine physician, so they specifically seek me out for that kind of opinion. And if you have an unstable joint, if you have an end-stage arthritis type picture, I'm not necessarily going to fix that by using an orthobiologic or regenerative medicine type product, but I may help manage some of your pain. These aren't an end-all, be-all, I'm going to do this and it's a miracle type procedure. It's more of managing the inflammatory process that's going on within that structure, or in a soft tissue, help remodeling that structure and prevent some of the scarring that's going on. So in that respect, as far as arthritis and tendon injuries, we're using them as an augmentation or another tool in the toolbox instead of just jabbing someone with a medication.
This next question we might have to spill into another segment, but orthobiologics. It definitely, it's one of those words that isn't super common. Yeah. But it includes way more than just PRP therapy, things like stem cells and so forth. What are some of the most exciting developments that you've seen in that space kind of quickly that maybe people should know about?
Yeah, of course. So there's lipoaspirate, which there's more mesenchymal progenitor cells, or what people call mesenchymal stem cells, in people's fat. You take a little bit of that, you wash it and clean it, use that. And then we're now starting to identify some different proteins within your plasma that you can use as well. So not the platelet-rich part, but the platelet-poor part that you can use. I think that's going to be the next step in orthobiologics.
That's really interesting, what can be used inside your own body to help heal your body. It sounds almost too good to be true, to be honest.
I mean, it's your own stuff, right?
Right.
Yeah.
You'd think that's how God created you, to kind of heal yourself, right?
Yeah, definitely.
And not enough people, I think, really kind of get to know or understand, because it seems like a lot of people think that when they say PRP therapy, it's just for elite athletes.
Yeah.
Because that's who primarily has been using it for, the last decade or two.
Right. And cost is probably a part of that too, right?
I would say cost is probably a huge part of it.
Yeah.
How much does something like that cost?
So that goes into another topic too, as well as concentration. The concentration, if you're using platelet-rich plasma, makes a really big deal. So a lower concentration with a lot of systems is going to put you about 2 to 3 times the concentration of your platelets within your plasma, so your normal plasma, and then concentrated down PRP, where a high concentration, closer to 8 to 10 times, is going to be better for most injuries and most arthritis. A lot of people will pay less for the lesser concentration, and it'll have less of an effect. The higher concentration tries to make it, you try to make it more reasonable and less expensive. Where I am, we charge $500. I tried to make it the least expensive because that's how much the kit costs and the time for the visit. Other places in town are charging, there's a guy down the street that's charging $3,500 for the same thing that I'm doing and using the same system that I'm doing. So that's where the difference comes into play with cost. And some of the other systems use the lesser concentration, and they'll charge a little bit less. And so patients will come back and they'll tell me, oh, well, I can go there and get it for less expensive, but it's because it's the least or inferior product.
And that makes total sense. Dr. Balle, this has been an amazing breakdown of regenerative healing. For anyone who's watching and wants to learn more or connect with you, where can they find you online? A website or LinkedIn or social media?
Sure. If you Google my name, I'll pop up on my office number, and you can always get a hold of me that way. My LinkedIn is a good way to get a hold of me. I field messages from there all the time, and professionals will reach out. Sometimes I'll get some patients that'll reach out, and then also my Instagram. I actually have patients, and I have med students that reach out to me too, and residents to talk about different things, and some other sports medicine doctors occasionally that we have stimulating conversation from it.